So, as Marguerite introduced me, I'm the CEO of Rare Diseases International since now 1 year and a half. I'm based in Geneva. I have a global health and public affairs background. And I have a team now of 9 people, um, global advocates, but also people in charge of strategic engagement with members and also others of specific program. I will start with a very short introduction about who is RDI. I assume some of you knows, but some other may not. So, and then the second point, I will definitely share with you the perspective of RDI on access to treatment. We've been involved we did a study with IRDIC, and I will base my input on this study. So Rare Disease International, it's the global alliance of persons living with rare disease and their family across all countries and all rare diseases. We have so far 116 members in 150 countries, actually. So we cover the 6 continents. And part of our members, we have mainly, rare disease national alliances and also international federation like the Prader-Willi Syndrome. And we have also regional alliances like IPWSO, the one of Asia Pacific. We have also the one in Latin America with ERCAL and ALIBER, and we are supporting the African Regional Alliance to come together. And we also involved in the 7 multi-stakeholder platform. So the vision of RDI, it's a world where people living with rare disease and their families experience a better life through full recognition and support. Our mission is to be a strong common voice for the community around the world. And we do this with 4 strategic goals, which is the first one, it's to build capacity and enhance our members' engagement to increase influence and reach. The second objective is to influence the global policy ecosystem for prioritization of rare diseases in the global health agenda, and also having more sustainable resources for rare diseases. The third goal is to improve access to treatment and care for people living with rare disease through care pathways and network for rare disease. And it's in that space that we are involved in some certain program, notably with our partners like IRDIC and others. And then the last one is to drive better outcome for the community through some strategic partnership, notably with the World Health Organization and with other partnership like recently the Program for Health, where we analyzing the situation around healthcare and social protection in various countries. And ultimately, all this is to improve equity for people living with rare diseases. So this is not to go through, but just to show you our strategy in RDI, linked to the vision mission that I just referred to. We have our values, our strategic goals, and we do it really through our different pathways, strategic engagement to support our members, the global advocacy to really shape the ecosystem, the global program, as I mentioned, and the strategic partnership. And so now this is the part where I would like to present to you the outcome of a study that we did between 2022 and 2023 with IRDIC. We had a global access working group, and the members of that working group, so 20 members from 14 countries, so 8 RDI member organizations, some regulator, clinician, pharmacist, researcher, industry, and IRDIC. So it was very multidisciplinary. We look at really what was the barriers to accessing rare disease medicine. And we did it based on case studies. We had 2 case studies. The first one was on cystinosis, and there was interview carried out in 11 countries, They're listed here, Australia, Canada. So we really try to make it a global. And the second case study was on 60s fibrosis, where we had interview in 7 countries. And the lesson learned really from that study is that there is actually a wide range of access challenges that are reported in different country settings. And also that the availability of diagnosis and early diagnosis are really essential to being timely treated and care for all medical conditions. So I will go more in details with some of the outcomes that we find. For example, the first thing we realize is that for each actually actors, the pain points are different. The first column on the left is from families and patients. And you can see that here it's about having no access to life-saving medication. It's often the out-of-pocket payment. It's the delay in HCA after medicine's approval. It's the fact that compound medicine, which have different quality affecting efficacy and compliance, so side effects also. It's the test, the dosage, lack access to trials, clinical trial also came out. And delayed and long diagnosis. So already, I don't know if you see, but we can see that the question around access to treatment is not directly the treatment. It's all the other things also that come with it. For the health practitioner, it's different pain points, like, for example, the difficulties to able to only provide the symptom, EV administrative burden, etc. I'm not going to go through all of them, but it was interesting to see that if you ask someone what are the challenges around access, they will come with different perspectives, which enable us after to draw what could be the solution. The other aspect that we find out is that there are actually really different clusters of access, according often to the GDP of country, but not only. We can see, for example, in the first cluster where the availability of medicine and the capability of diagnosis is quite high, there is Colombia, next to Canada and Belgium. In the other cluster where actually the availability of medicine is very low and also the diagnosis capability, we have like Malaysia, Vietnam, and Ghana. And then third cluster, which is a bit more advanced quite well advanced in diagnosis capability, but less in medicine availability. We have South Africa, Australia, Thailand. And the last cluster, which is a little bit high in diagnosis and good availability, but still not optimum. It's Spain and Mexico. And now we really identified the main, I would say, barriers of access. The first one is on the left is the lack of validation test, the lack of experience labs, often, lack of awareness, and limited workforce. The other pack of challenges is the out-of-pocket payments. It's often also import rules and procedures. It's also the negotiation with distributors that can be very problematic and delay the access or the availability of the treatment. It's also compliance issues, logistic risk. And the last one, which is more when the medicine is the treatment is there, but there's still issue around the quality of the product, the formulation strength, timely reimbursement, knowledge sharing, care arrangement, and transition from pediatric to adult care. It's often something we forget to mention, but it comes a lot recently in many discussions. There is a lack of transition between the situation of pediatric and adult, and the support for carers also, very important. And so based on that, we have identified some then solution or element to improve access. They may look very generic and general, but it's a good start to dive into for policymakers that would like to try to improve, but also for every stakeholders. The first one is the importance of existence of patient support group. And I'm sure you're very aware about that. Supportive clinicians. The third one, clear regulatory pathway, which are not often obvious, and where the patient community really have to be involved to help to have those pathway. Sorry, my dog is making noise. The other one is clear importation pathway also. Again, it's efficient regulatory to HTA process. Then exchange among experts, so really encourage the knowledge sharing from the use of the treatment. And the last is alternative diagnostic routes also that can be an accelerator. Now, I would like just to share that graphic because it refers to the 4A, so it's not RDI that came with that. It's from a publication that is quoted below, but it's really about availability, making sure that new medicines are present in country. The second one is accessibility, making sure that people can get hold of the medicines. Then affordability, making sure people have enough money to buy the medicine. And then the last one is acceptability, making sure people are willing and able to use the medicine. And I think this 4A also summarize a lot what we came with from the study that we did. And then we try to put together what we could call a framework for access. But actually, I will explain why after it's not straightforward. It's not straightforward also because so we have a lot of kind of key thematic where some policy could be drawn from it, like awareness education, logistics, security. It's really show that access is not just having the drug, it's everything that enable basically the access to the treatment. So it's much more broader. And the reason why it's not straightforward, this is because according to every country, obviously the situation is different on the access, because there are so many elements anyway that make an access a real access. We can imagine that every solution has to be adapted to the situation. This is really what we learned from the study that we did with the working group in IRDIC. And so drawing a framework for access, this is also something that since have arrived in RDI, we tried again to think, can we really draw a global framework for access? And this is something we are still discussing. And notably, one thing interesting with the exchange we had with our organization, and notably the international organization, is that instead of talking about a framework for access, we would like to talk about a framework for quality of life. Because I think what our patient organization are telling us is that, okay, it's true, access to medicine, to treatment, this is an issue, but it cannot even be solved without addressing the holistic, without having an holistic approach. So I think it fits something I could share with you, since you are looking at also the issue around access. But this is the message I wanted to give. I would like to, I'm almost finished, but I have two points still. So basically, we realize also that to really have an impact on access, we have to think like to still address the lack of awareness. So it's in that cycle, awareness, screening and diagnosis, continuous treatment, and continuous care. So this is really how we want to kind of evolve in trying to improve access to treatment, is to put it in the more general approach. And then, okay, I wanted to finish on one thing that RDI is very involved right now, because I'm going to explain why it's very much linked around the improving access to treatment. It's the resolution that is currently being submitted to the World Health Assembly, to the World Health Organization, to be adopted during the World Health Assembly in 2025, because this resolution is going to ask the World Health Organization to develop a global action plan on rare diseases. And it will be the time to develop the global action plan, and the time to have it adopted again by the member state. We aim to have it in 2027, and it will be a 10 years action plan. And it's going very well. We have 7 co-sponsor countries, including France, Spain, and Qatar, Panama, Chile, etc. And why I wanted to make the link with your discussion today is because this resolution have notably 2 objectives. The first one is to promote and enhance universal coverage to improve public health and social measures needed to support people living with rare diseases. Because if we don't strengthen health system, well, our community will always struggle to have access to afford also the treatment. And the objective 2 of that resolution, again, I highlighted in pink because it's related to your topic today, is to ensure that people living with rare diseases will have access to affordable, effective, and comprehensive healthcare services. And this is something that this process of the resolution and the global action plan would really enable, because this global action plan will create some targets and an accountability process. It means country will have to come back to the World Health Assembly every 2 years and to report about the progress they made around the policies they've put in place for rare disease, also notably policies on access, etc. So I think it's a very interesting, very relevant process to have a chance to have the right policy in place at global level, but it's also at national level. So voilà. So notably, one of the impacts that global action plan on rare disease could have, if it's developed, and adopted in few years, it would definitely address the issue around equitable access to evidence-based treatment. It will also address the structure of the health system, ensuring that rare diseases are integrated in it. It's a long and ambitious work, but as I said, it will be over 10 years, and there will be overall process also for the community to be consulted in developing the plan, and also on the ground at national level to really build the capacity to have this plan being implemented according to the reality also of the countries. So we should never undermine the fact that one solution doesn't fit all. I think we're all aware about it, but it provides a great opportunity for the rare disease community, and notably around the issue about access. So I will stop here. This is, voilà, was the end of my slide. I'm stopping sharing. But I hope you did find it interesting, and I'm available to reply to your question.